Médecins Sans Frontières are on the front line of emergency care. And to discuss some of the world's emergency hotspots, I'm joined by International President Joanne Liu. Many thanks for being with me on the Global Conversation. Now, MSF recently slammed the international community for its response to the Ebola crisis, warning of a double failure. On the one hand, a too slow response initially, and then possibly an inadequate and patchy response following that. So right now, are you satisfied with the international community's response to this crisis?
I think being satisfied would be a very generous word. What I would like to say is people have heard our message, some mobilization has happened. Right now, what we would like it's some flexibility and adaptability in the response, because a lot of the response that is deployed today is responding to yesterday's needs. It's tailored to that. And now we're saying, things have changed, you need to adapt. And then we're not building anymore those big centers of 100 or 200 beds of Ebola isolation, but we need smaller centers in the countryside. That's the challenge.
Now, you've been on the ground. What does it feel like to have Ebola?
I think I will never get over those images in my life. During my last visit, I visited a ward. There were 7 patients. And we say 3 of them were in really advanced disease. They were unconscious, bleeding from the mouth, bleeding from the stools. And we were very concerned about their medical situation. And what I thought was the most, I would say, distressing and really hard to witness is just to see them being all by themselves with no loved ones, and us, in spacesuit running around and then caring for them. And I always tell myself that I don't think that the human being is meant to die alone.
And how many more people will have to die, do you think, before this begins to turn around? Because more than 6,000 people have died. There are thousands more infected. Where do you think this is going to run to?
It's very difficult to make any projection. I think everybody who've tried to make projection, we had the worst case scenario at one point. They were saying, by the beginning of 2015, we might have 1.4 million cases. I don't think we're going to reach that, for that. But the reality is, I think that the key message for me today is, although in some areas the number of cases have slowed down, we shouldn't cry victory. We have maybe won a few little battles, but we haven't won the war against Ebola.
You're now trying out new treatments in some of your clinics. Can you tell me a little bit about that? How's it going? When can we expect to have results?
Hopefully this month we will start 2 of our trials at least on antiviral medicine for patients who are infected in 2 of our centers in West Africa. So this will run for a few weeks, and then hopefully in the first trimester of 2015 we will have the first results.
And in terms of a vaccine that's also being tested in the US, I believe, is that our best chance for containment of this, or do you think it can be contained technically, physically on the ground?
When I look into the future, what will stop at a high scale the chain of transmission of Ebola will be a vaccine. And we do hope for that tool to be available as soon as possible.
And when you say as soon as possible, when?
Well, we hope that in 2015 we will have a vaccine available for the most in need in West Africa.
So we've asked our online community to get involved in this interview, and we received a lot of questions on social media. And we received this question from Jen Schrady, who asks, are you getting the support you need? And I think you've answered that part already. But which country is providing the best and most helpful support to combat Ebola?
United States in Liberia has been heavily involved, and other one who have provided some centers. I think that if we compare it to the first, I would say, pledge by President Obama, we're a bit far from what he has pledged in September, but they are deployed and they are invested. What we are asking, especially for everyone who's been funded by US funds, is to make sure that they will be flexible, because today we don't need those 17 centers of 100 beds, but we probably need few of centers of 25 beds in the countryside. So we just need to tailor it to the needs.
So what's going to be the long-term impact of this virus? Because we're seeing that schools are closed, the economies have basically shut down. What's going to be the impact?
It's going to take years to get over this. loss in terms of life, loss in terms of infrastructure, and I think that we actually don't fully measure the impact of it. It's really important that we do not focus ourselves, because we're starting to see some positive result in the field, to put all our energy in creating a response for tomorrow's future when we still have outcrying needs today.
This is one of the major emergencies you're involved in, but MSF is actually involved in some 67 countries around the world. I know you have teams in Syria. It's been very difficult for you to stay in Syria. The government there, President Bashar al-Assad, has not allowed your teams to operate. You've managed to negotiate in some of the rebel-held areas. What are you seeing there? What are your teams witnessing?
So right now we have very few accounts because our presence is quite limited. And that's really, I would say, distressing and disturbing, because we know today that Syria is one of the biggest humanitarian crises, and for us is an operational priority. But right now, we are not able to respond to the magnitude of the crisis. That's the sad reality.
Why are they not allowing your teams in?
Well, the thing is, we're not able to get the security warranty to provide, I would say, a safe environment for our team to deploy.
Well, your group must be faced with great moral dilemmas, because I know that in the past, MSF has had to pay tax to Al-Qaeda-linked militants to be able to operate in certain areas. How do you evaluate a situation like that?
Well, the reality is wherever we work, we are paying tax. You know, if we are working in a government and want to import goods, like antiretroviral medicine in a country in Africa, you would not import it, you know, free of tax. Everywhere we pay something. At one point, it's a governing government that is there in the authority, or it can be another type of authority. That's the reality in the field.
But it must be very difficult to weigh the good from the bad, because you know that this money that they are reaping from organisations like yourselves probably won't be used for the best purposes.
You know, we always weigh in, you know, what is the action we want to do, and what would be the impact. And so when we think that we can have a real impact and save lives, then we negotiate a presence with the party in place.
And Ray Like a Boss, this is another member of our social media, asks, how do you manage to arrive in conflict zones?
We have to build an understanding of the geopolitical situation. And after that, when we go on site, because I've done in the past what we call those exploratory missions, when you go is to talk to everybody and then explain who you are, and then try to get warranty for your work that you would like to deploy, making sure that your work you're going to do will have an impact and will respond to specific needs in the field. So that's how it goes most of the time.
You're also operating in Europe, on our doorstep, in Ukraine, for example. What's been the impact there on your work since the government stopped medical services in eastern Ukraine?
Since the action of the government and then the start of the conflict in May, we've been providing aid in different facilities on both sides of the conflict, and mainly in terms of mental health, because one of the things that we have I would say, been confronted to is the fact that the population is highly traumatized by what they've been going through with the different, I would say, attack.
If you had a message for President Poroshenko, what would it be?
Well, I think that right now we need to allow access for aid to come in, and as well facilitate, I would say, all the administrative red tape that is necessary to do so.
Because your work is being hampered?
A little bit, yes.
Okay, so the responsibilities of your job must be enormous. And here I'd like to bring in this voice, and this is Lulu Nurama, who says, what is the most difficult problem that you've ever met, and how did you solve it?
What is the most difficult, it's when in some areas we don't have acceptance from the population. But sometimes, like we've seen in West Africa, is people do not understand what we're going to come and do. They are scared. At one point, like for Ebola, they thought that we were bringing Ebola to them, and then people were rejecting us, but physically rejecting us. And so this is difficult because we realize that sometimes we need time to be accepted. But when you have, for example, like Ebola, a disease that has 50% case fatality rate, and you want to act quickly, you don't have the luxury to wait that much. But we know that the community acceptance is key to make our work a success.
Dr. Joanne Liu, many thanks for being with us on the Global Conversation.
Thank you.